Welcome to the All Eye Care Corner. My name is Dr. Trinh.
And I am Dr. Lauren Zabaleta.
So on today's episode, we're talking about keratoconus.
Keratoconus.
So Dr. Zabaleta, tell us, what is keratoconus?
So keratoconus is a condition of the cornea, and the cornea is the front surface of the eye. And essentially it's bilateral, which means it happens in both eyes, but asymmetrically. So one eye is usually worse than the other. And it's a thinning of that tissue of the cornea that results in kind of a cone shape of that front surface of the eye that results in pretty poor vision for these patients, even with glasses.
So who's at risk for this keratoconus condition?
So, we're not entirely sure what causes keratoconus at this point. There's a lot of different risk factors that we've considered might be part of it, but it's relatively rare. So only about 54 people per 100,000 have the condition. There's some sort of a genetic component, so we see sometimes within families there's patients with keratoconus. Eye rubbing is a huge predictor of keratoconus, so for any of you rubbing your eyes while you're watching this video, just cut that out right now. And then things like A to B, so allergies can kind of be a risk factor, but again, all of these risk factors haven't been 100% tied to the condition. They're just kind of associated at this point.
So if somebody does have keratoconus, how do they know?
So it's tough to diagnose. Fortunately, now we have a lot better technology, so we're actually finding keratoconus a lot earlier. One of the best ways to diagnose keratoconus is actually from a map of the cornea, which indicates essentially that conical shape, that cone shape, and we're able to see that and say, okay, this correlates with what we're finding in terms of reduced vision and diagnose it in our patients much earlier now than we were able to before.
So you're getting a geographical map or a topographical map of my eye?
Exactly, yeah. So we're scanning kind of for the steepness and the elevations within that front surface, and you or I might have more of a basketball-shaped eye, but then our patients with keratoconus, we're seeing that area of steepening, and that's helping us to diagnose the condition earlier and treat it earlier.
Oh, that's crazy. So if somebody has keratoconus, is this going to impact their vision?
So it's definitely going to impact their vision. There's a lot of research that shows that keratoconus can impact quality of life, but fortunately, if we're able to figure out what's going on and understand why our patients aren't seeing well through something like glasses, we can pursue contact lenses that actually can help the patient see just like you or I. The goal of glasses is to position light at the proper spot in the back of the eye, but with glasses, that light still has to hit all kinds of hills and valleys from that cone shape before it hits the back of the eye. So even though it's focused at the right plane, it's hitting all over the place, and so these patients are still having blurry vision, even with glasses. But when we integrate specialty contact lenses, which are more rigid, it actually creates a new front surface of the eye that helps light focus perfectly in one spot on the back of the eye and gives them great vision.
So you just basically created a prosthetic cornea, essentially.
Almost. It's almost like we're giving them a new cornea in the sense of a contact lens.
So have you seen life-changing events with patients that have this condition?
Yeah, so patients that I've seen with keratoconus oftentimes come in, they're not sure why their vision's decreased, or maybe they even do know and they can't even drive a car, they can't do their daily activities of living, and we're able to put a contact lens on them, and within that singular moment, they kind of have their world changed. They can see again. I've had patients joke that they didn't realize how dirty their house was until they got their contacts on. They're like, wait, why haven't I cleaned that? But it's because their vision wasn't as crisp, and we're able to give them that quality of vision and oftentimes give them quality of life back.
That's amazing. I mean, to be able to kind of change a patient's life just instantly by putting that lens on, it's just,
It's amazing. Yeah.
So what are the other solutions for keratoconic patients? Is it just one type of lens that you have?
So there's a number of different types of rigid lenses. The first is something called a corneal gas permeable lens, which is a smaller rigid lens that kind of sits on the cornea. Another lens called a hybrid lens. It's kind of a cross between your traditional soft lens and that smaller rigid lens. And then some of our newer technologies, something called a scleral lens, and that lens is actually intended to completely vault over the entire cornea, and it lands on the whites of the eye. And this lens is super comfortable, provides great vision, and really changes patients' lives.
Wow, that's crazy. So is keratoconus a progressive condition?
So keratoconus is a progressive condition. That's why it's so important that we're catching it early and kind of doing screenings on our kids so that if they do develop it early, we're able to intervene at that point. So first intervention would be avoid eye rubbing at all costs. Just keep your hands away from your eyes. And then a new procedure that's been more recently FDA approved is something called corneal cross-linking. And we recommend this to our patients that we see progression of keratoconus or even our young patients at diagnosis. And it's essentially a procedure that combines ultraviolet light with riboflavin or vitamin B drops and is able to strengthen the collagen fibers in the cornea to prevent that outpouching and that conical shape from happening. And it really prevents the keratoconus from progressing to an advance. Patients with keratoconus should definitely pursue some sort of rigid specialty contact lens. Even in our more mild patients, we see improvements in vision with those specialty lenses from glasses. And so making sure that you have someone that can fit a rigid lens for you and fit it well is really going to change quality of life for these patients.
So what age group is most at risk for the development of keratoconus?
So we typically see keratoconus develop in late teens, 20s, even early 30s. But nowadays, because of all of our diagnostic tools, we're seeing it develop even earlier in young kids. And so it's probable that it just wasn't found in those populations before and that it did exist. So we want to be hyper aware for kind of any of our younger patients coming through that this has the potential to be a condition that they have. Certainly it's a rare condition, but just because it's rare doesn't mean that it's not something that we should screen prevalently for. And so taking a look at those maps in our pediatric patients has been super helpful.
Fantastic. Well, thank you so much, Dr. Zabaleta, and that's the conclusion of our episode on keratoconus.